Cabinet Office Minister, Michael Gove. Excited to speak to him this morning. Joins us now. Hello to you, Mr Gove. Always a pleasure. Thank you for joining us. What restrictions are the government introducing today? Has it actually been decided yet?
Yes, it has. The Prime Minister will be announcing the full package to the House of Commons later. But as has been reported in the media, it will be the case that there will be a new restriction. So, for example, when it comes to eating out, to socialising, then it will be the case that establishments will close at 10 and we will have a rule that it is table service only. But there'll be more details that the Prime Minister will spell out. And again, one of the points that he'll make is that no one wants to do these things. No one wants to take these steps. They are reluctant steps that we're taking, but they're absolutely necessary because, as we were reminded yesterday, and as you've been reporting, the rate of infection is increasing, the number of people going to hospital is increasing, and therefore we need to act.
When were the decisions taken and by whom?
Well, decisions like this are taken by Cabinet committees. Of course, I can't go into the details of which committee meets when, but in essence, a package of advice was put to ministers. That package was prepared by the authoritative medical and scientific advisors who are there to help the government to make these decisions. Ministers look at what might be considered wise, then we agree, and then, of course, this package is put to the House of Commons.
So it was a cabinet decision. Talk to me about whether people should be working from home again now, if they can.
Yes, there is going to be a shift in emphasis. And one of the things that we are going to emphasise is that if it is possible for people to work from home, then we'd encourage them to do so. Now, it's important to stress that there are many roles which can't be performed from home. There are people in manufacturing, in construction, in retail and in other roles where we recognise that's simply impossible. And that's why we have worked to make sure that you can have COVID-secure workplaces. And we need to balance, obviously, the need to ensure that people can continue to work and indeed critically continue to go to school and to benefit from education against taking steps to try to reduce the virus, which is why if we can limit or appropriately restrain social contact, that's what we're trying to do.
You will know, our viewers may not know, that the government aimed to have 80% of Whitehall staff back in the office by the end of this month, which is, I think, 8 days away. Is that still the plan?
No. One of the things that we sought to do was, of course, to encourage people to be back at work. And we were staging a process whereby people would come back into work in Whitehall and elsewhere. But I've been in discussion with the Permanent Secretary at the Cabinet Office, and one of the things that we recognise is that in the circumstances, if we can help people to work from home, we will. But if people do need to be in the office, then we will make sure, we have made sure, that they can be as safe as possible.
Are these new restrictions an admission of failure by the government's approach? I'm thinking particularly, as you'll know, the Eat Out to Help Out scheme. Looks a bit silly now?
No, I don't think so. I think it's the case that we have to react to an increase in the spread of the virus. And, of course, the steps that we took in order to help the economy during August, I think, were welcome. But we need to recognise that there are now some restrictions that need to be put in place. But I should stress that it will be the case that hospitality venues will remain open. But we're just making it clear that it's table service only and closing at 10. And these are measures that have been introduced in some parts of England. We hope that they'll now be introduced and monitored across the United Kingdom. And as I say, it's not a step that anyone wants to take, but we think that it's a proportionate response given what we've been told about the spread of the virus. And of course, a stitch in time saves nine. By taking action now, we hope that we can avert the need for more serious action in the future.
So a second wave was a surprise?
Sorry, I missed that, Kate.
So a second wave was a surprise to the government, was it?
No, right from the very beginning of the pandemic, we made clear that, of course, we would take the measures that were necessary in order to deal with the spread of the infection. And sometimes those measures would be applied flexibly. So the Prime Minister's made it clear that in those parts of the country where the virus is particularly fast spreading, that there are tighter restrictions. In other parts of the country, not so much. And also these measures are a response to the increase that we've seen. And we keep measures, forgive me, constantly under review. We've seen the situation in France and particularly in Spain, where a significant increase in the spread of the virus has led to more people going into a hospital and led, in particular in Spain, to the number of deaths rising. That's something we want to prevent. The scientists estimate that only about 8% of the population have acquired immunity as a result of the spread of the virus so far. So that means that there are lots of vulnerable people whom we want to protect. And because we're going into winter, it's also the case that the risk to individuals, particularly those who are more frail and infirm, is greater, not least because the combination of flu and COVID is particularly challenging.
Indeed so, but, you know, with respect, you wanted people to go out and dine out, you wanted people to go back to work. We always knew the second wave was coming because you made provision for PPE, etc., in the last budget by Mr. Sunak. So why were you actively encouraging people to go back to work and to go out and socialise if you knew this was coming?
Because again, when you're dealing with a virus like this, you need to be able to respond to changing events. None of us can predict with absolute accuracy how the virus will spread. We take steps on the basis of the best scientific advice. We take those steps in the belief that they will have a beneficial effect, and we again review the evidence. That's how science works. Science is not something that allows you to predict with absolute accuracy what the future will be. Science allows you to weigh up and to balance evidence and then to respond to events as appropriate.
Yeah, but your colleague, the Health Secretary, was basically telling us at the end of last week and over the weekend that if there is a continuing rise in the virus, then we've only got ourselves to blame, particularly young people, those young people that you wanted to go back to work and to eat out to help out. You can understand why there's confusion in society, surely.
No, I think, to be fair, you're, how can I put this, taking Matt's words and putting a particular gloss on them, which was not...
However you like.
What? No, I don't.
You can put it however you like. I've got a thick skin.
However you like. I've got a thick skin.
I understand, Kate, but no, I don't think that's what Matt was saying. I think it's the case that the overwhelming majority of people have behaved well. That's one of the things that we can take away from this year, that the British public have shown amazing resilience and stoicism, self-discipline and a sense of community. There have been some people who haven't necessarily played entirely by the rules, but overall what we want to do is to make sure that we do the right thing. The majority of people want to. The measures that we've announced so far command public confidence. No one is blaming anyone. We're dealing with a natural phenomenon. The virus is not it's not a character that you can point your finger at and blame. It is a scientific reality with which we have to deal.
How would you characterise discussions within Cabinet when it comes to what measures should be put in place? I'm guessing you don't all agree. I'm sure you agree collectively in the end, but there must be robust discussion.
Well, by its very nature, Cabinet and Cabinet committees involve discussion, but those discussions are calm, evidence-based, people weighing up different options, testing the evidence to see what would be the best response, and then calmly and resolutely agreeing on what requires to be done.
Who agrees with you?
Well, I agree with the rest of the Cabinet.
Yeah. As I said, there must be robust discussion before you collectively agree. I hope there is. Otherwise, you're just following the herd, aren't you? I'm asking who you agree with, who you tend to side with in Cabinet.
Well, by definition, you will have robust discussions beforehand. So on a television programme like this, the producer and the editor will discuss things with the star presenter. It might well be the case that there are raised voices during that discussion, but at the end you get a very, very professional product. There are no raised voices in Cabinet. What there are clear voices articulating points of view which come together in a consensus. But by definition, The important thing about government and cabinet government is that we have an agreed position, one that's arrived at looking at the evidence, and then we implement it.
So you're all responsible, really, for the poorest regions suffering disproportionately?
Well, I take those two things. Yes, there is collective responsibility in government. We're all responsible. But you're right that there are particular concerns that I have and that the government has about the structural problems that our country has. One of the reasons why the Prime Minister is so committed to what's called levelling up is a recognition that for a long time now, wealth and opportunity have not been equally spread across our country, and therefore it's vitally important that over the lifetime of this government we do everything we can in order to help those in communities which have not been well served in the past. And there are a variety of things that we can do. Investment in the NHS is one aspect of it. Investment in better public health is another. But so is investment in education and infrastructure, and also doing more in order to make sure that our economy rebalances and heals.
I must let you go, but one final question before I do, Mr. Gove, if I may, please. I'm sure that you've heard of the label that sometimes is given to the Conservative Party as the nasty party. I make no comment about that at all. I just refer to it. I'm sure you've heard of it. If you cancel Christmas, what do you think you'll be called then?
We're not going to cancel Christmas. It's going to be on December the 25th.
And what will it involve? Will people be able to gather together in more than groups of 6?
Well, it's by taking steps now that we can, I believe, be in the best possible position to allow people to enjoy time with their family on the most important day of the year.
So it's up to us again, isn't it, to behave? That's what you're saying?
No. Again, you're brilliant at putting a bit of shine on the ball and trying to take what I say and present it in a particular way. But we were reminded by Chris Whitty yesterday that the virus is something which we all have to deal with. And as I say, blaming people, finger-pointing, recrimination, no. But community working together, solidarity, yes. And so I think what we should actually be doing is celebrating the work of people at the front line in the NHS, thanking our scientists and those in authority with the expert information for levelling with us. And also I just want to thank the British people for the resilience they've shown. Look, these decisions are not, as I say, they're not easy and the consequences are not happy. But unless we take these steps now, then the situation would be worse for everyone.
OK, so, but you are, I'm guessing, hoping to have more than your lovely wife and your 2 children for Christmas lunch. Maybe, I don't know, maybe have Dominic Cummings round?
Kay, if you're free on the day, please come round.
OK. You know what, I might take you up on that, Mr. Gove. It's good to talk to you. Thanks very much indeed.